Yep.
Okay, I was waiting for you. That's old business. Okay. I want to call this Board of Health study session on Thursday, November 2nd at 4:30 p.m. to order. Could we call the roll, please?
Daniel Chenoweth.
Present.
Andy Forster.
Present.
Kyle Patterson.
It looks like Board Distributed Chenoweth are present. Public participation, is there anyone here who'd like to speak before the board? If not, we'll go into old business. We received a procurement policy at our last Board of Health meeting, which gave us a few weeks to look over it, and this is our discussion time for that. Is there any presentation or statement of staff before the board gets started?
Do you want one?
I mean, I think it would be helpful to get a summary of where we're at in the process. That would be great.
Well, I can just give you an overview of, you saw what was put together, and we tried to put in, they looked at, it was the county's policy and the city of Urbana, I think, are the main ones. No, just the county.
That's all I knew.
And we had Jim involved, we had Makai involved, and we had Sean involved. And Sean used to do this kind of stuff. He's been on both sides of it. He's been somebody who accepted bids, and he's been somebody who bid, I guess. So we just sat in the room, and we had all the directors and everybody in there, and what we did was basically go through the policies to see, did we do that? Yeah. To see if we had anything that looked like it would be, weird or difficult for us to do, and that's pretty much what shook out of the thing.
Okay. Has there been any updates since the documents were given to us?
One only change that I made was I added union on the scoring sheet.
And was there a veteran one, or was that already on there?
It's on there already.
Okay, because I was gonna say, somebody asked us about that.
I suggested that we had veterans.
Okay. So that's the only change that was made from what you have.
Okay. I received from IBW I'm getting the name wrong.
Yeah, we got it.
It was a PLA labor agreement, project labor agreement, and I read the project labor agreement, and it was difficult for me to understand what a PLA gets you, because I'm not in that world, so perhaps, I don't know, Andy or Ruth or someone understands it, but basically, it seemed to only be about leveling the playing field, like, here's the, if you can go out to bid for non-union and union, but they have to follow the same kind of set of criteria. I didn't see a lot of details in terms of what they were asking for in the bill.
Is that a prevailing wage? Is that where that came from? I think it is.
So we're all required to do prevailing wage, so.
At the township, you mean?
Board of Health as well, right? I mean, the CUPHD is required to pay prevailing wage to labor.
Okay.
I would assume so.
This is
Local
what
government.
I don't know.
Yeah,
I thought that we adopted that a long time ago for specifically this reason. We didn't. I think that it was a long time ago, but I think that it was Fred said we don't have to do it, but there's no reason, not to, and I think Carol Elliott's the one that had us do it originally, as I recall.
Okay.
And it was a long time ago, but it was basically just to make sure that we did the prevailing wage, and that was so that we wouldn't get bids, so basically so that everybody was bidding the same hourly rate kind of thing, if that makes sense.
That would make sense.
I thought it was for all public,
It used to be all federal money,
but
but I don't know if there was a state requirement, at least there may be now, but I don't know if there always has been. I know it's been federal.
Yeah, it's been, we've had that forever, since, for a long time.
So what's that, is it like a board policy, or is it it's
like
a procurement
We
policy?
have nothing in writing about that,
Because
I've not done anything with it.
We just always ask for it and get the payrolls. We do that with everyone, we always have, for, 20-some years that I recall.
I do remember a long time ago, we did a board resolution for prevailing wages.
Okay.
So here in 2020, if I may, the Illinois Department of Labor wants to remind local units of government that while they still must pay prevailing wages for public works projects, a 2019 change in the law means they no longer need to adopt a prevailing wage ordinance or file it with IDOL. So we apparently have to pay prevailing wage.
So what entity?
We do.
This is Illinois.gov, Illinois Department of Labor,
Yeah.
excuse me.
And in our purchasing policy regulations procedures, I believe the one that has the number 9200-07-01, that is our existing one, correct? What the document, it's called, that's not the proposed. It's Champaign-Urbana Public Health, no, this is the proposed.
Yeah.
This one, if it has this page, is the new one.
That's the one I'm looking at,
Okay,
okay.
the proposed, the current one, within that group of bio two, it would have been named the same thing.
Just 5 pages instead of 16.
Yeah, I just wanna know, I think just like what Andy had showed with the Department of Labor, local governments, this is sort of some of the issue, like the issue we had at the last meeting, whereas, well, it's Champaign-Urbana Public Health District is certainly a government entity, so subject to, Open Meetings Act and FOIA and that sort of thing. But I don't know that because it's not under, it's not a municipal government, it's got its own public health act. And so, I'll look into that, I just don't, I wanna caution, because I think those are, the rules are different, for what township, what you guys would be used to, township and then county, compared to what public health is required to do. And so part of that also is in looking at the policy, rules, regulations, and procedures for purchasing, whether you want this to be mandatory and adopted as if this is a law and you have to do this. And so if you don't do it, then are there consequences and what are the consequences? Or if you want it to be sort of an aspirational, or may do that, or is it it's the goal, or that sort of thing. And that's really a policy or a decision for the board, but to think about it, just to consider those issues.
But I will just note that the existing policy does not say anything about prevailing wage, and the new policy basically says, in accordance with prevailing wage act, public works construction project bidders must pay current prevailing wage to all laborers. This is for construction. Workers, for laborers, workers, and mechanics when contracted via quote or bid during this policy. And there's a link to it. So, so it would just be helpful to understand what has been and what is. I've been, I went through the old policy, I went through the new policy, and so I'm still figuring out what the changes are, but I'm looking for the specific things that I'm looking for.
We have a prevailing wage something.
Had it been more like that.
Yeah, we have that, and
We've had for a long time, every year had the board sign a resolution for that.
Yeah, and we,
For the prevailing wage.
and, because we always
I think it's
ask for
every
that.
June, right, Amy?
Yeah, and then it changed where we didn't actually have to bring it to the board, but we
Yeah.
post on our
This is,
website.
it was.
In 2019, yeah.
Yeah, so
So
it goes
we-
every year in June.
Yeah, so the prevailing wage thing, we do. So we've done, and we even make, like when Vasquez has done, they did a lot of stuff for us in the past. We even had them do that, even though they were smaller jobs that weren't bid out. We tell everybody that they have to do that, and then they have to keep records of all that stuff.
Okay.
The issue is that we didn't bid very many things out.
May I just ask one question? I only had one question, and that was, and you noted it, so we are giving points for union.
I put it on the sheet.
Okay, so that would be yes, 5 points, no, 0 points, same thing. So now it's a total of 25 points. Or no, I guess that,
25 additional points, 10, but there's also 10 for the low bid.
right, 10 for cost and 10 for time.
Yeah.
Okay, so we're just adding another 5 points category, okay.
I will say one thing, after being in the industry for several decades, time estimates, I don't know if we should necessarily give points for that because that's an estimate. everybody takes longer than they're supposed to.
Yeah, and they're
So
gonna
if
have an
somebody-
That is
excuse.
for
If
sure.
somebody realizes they're gonna get 5 points for saying they'll be done sooner, they'll
Yeah.
tell you that,
Yeah.
but they won't be done sooner.
Unless we associate a penalty with it
Yeah.
or something.
Yes.
I agree.
That would jump suggestions, I don't know.
Yeah, if you give the points, then you have to penalize them.
Yeah. I would agree with getting rid of time estimates and making it more of a discussion, so we know that if it's something that's like health and safety, the time estimate's gonna matter, but it doesn't need to be part of the point process. So there's a little more, because I feel like that's a place to provide flexibility. And
You don't think it needs to be in here?
it sounds like, I don't think it needs to be part of the point process, I think it's part of the discussion process, because different projects will have different levels of time sensitivity, and I think staff should determine with the bidder how much, like, you can basically add points, and then you can have qualitative, it shouldn't entirely be a quantitative process, right? So then you have qualitative things like, this is an emergency, and we'll need it within this time frame, you know, or we'll need, you know, you can set constraints in that way. It's fulfilled all requirements. So I'd like to see the priority, scoring worksheet be included in the purchasing policy. So as long as there's, and the ordinance, so as long as there's language that indicates it. And then that priority sheet, I think it would be useful at least every 4 years to be looked at, because it's one of those things that puts on a shelf. And so with every new board, they could look at the policy. You might want to bring it every 2 years, just because not only does it help us remember that it exists, but it gives us an opportunity to look at what is important to us at that time.
I was kind of thinking about putting the priority, right above the bidding, like another, section 3 or whatever.
Oh, okay, yeah, in the
That's
policy.
what I thought you meant.
Yeah, that would be super. I think if it's part of it, I think it would be great. I just think it should be part of it, whether it's an attachment, wherever you put it, I think it should exist of that. The other piece that I, you know, and correct me if I didn't find it in this, but I think that a huge part of getting diverse groups to bid is how we do outreach. And so I think that having a statement, you can have an internal process that's kind of like all the people who you reach out to and how you do outreach, and that's gonna change based on circumstance in the community. But I think the policy should say that there is an outreach plan where, so many government agencies, they're notorious for posting a bid, and then that's all they do, they just post it on their website. And so that's not an effective way of getting a lot of bids, as everybody, anyone who gets bids knows.
We did
So,
spend a lot of
like,
time
really,
on
the
that.
outreach piece, honestly,
Yeah.
of everything, because I don't think, you know, there's a bunch of MAGA folks sitting around the table here, I feel like primarily it's about your outreach process. It's not like there's any intention to leave people out of the process.
Right.
I think instead it's more making sure that we have a robust process. It's time, it's a, you know, it's a pain because it takes more time. But if we can understand that part of the public health agenda is building minority and women-owned businesses and fair labor practices and good work pay and working conditions in our community, that that's actually a public health agenda, then it's, so to understand in the purchasing policy, one of the ways that we fulfill our mission is to ensure that we are.
So write like a preamble?
Yeah, that we are building we're empowering our local community, trying to keep dollars local, and supporting underrepresented populations and supporting worker rights and safety. So like having something that's very clear at the beginning and then says the public health department shall develop a, you know, robust outreach process that identifies and stays in communication with local, diverse and union-based bidders and veteran-based bidders, right? So, and then the best way to do that is you keep your list. You keep a list, you know, sounds like Champaign kind of, you know, you can pull from Champaign, you can pull from the state of Illinois has a list. You're continuing to keep a list in the community. And frankly, you know, and I'm glad that, you know, we have a facilities manager who basically is developing relationships with local, so that you're able to continue to send out the information to them. The other piece of the procurement I wondered is whether or not there was so the state of Illinois, and I guess this is a question for board members, which is the state of Illinois sets out minority and women-owned business goals. They set out goals. Because honestly, if you don't set goals, it's real easy to just slip it away, right? So the goals don't have to be like, if we don't hit X, you know, we are somehow legally liable, but it's more like the way the state does it is, they're gonna give money to this organization. They want you to have 30%, you know, minority or women owned. I made that up. I think it was more like 15 or 20%. And they ask you to say how you're gonna meet those goals. And one of the things that needs to happen in the trades, and the state has been helpful at this, and we should be helpful as well, is to ask folks who are doing large bids, okay, we would like to see a 15% minority women-owned business, or excuse me, 15% minority, because, or 20% or whatever. What we do is, when they subcontract, so they can either get it through their own workers or they can subcontract, and that's how the state works it. So essentially, and the state has a really good matrix for this. I've been through this now for 3 years, because I've run a lot of state grants, and they basically have required that you create a plan for meeting that. And it has helped us, you know, when I did it at the Independent Media Center, it helped us to really do targeted outreach to organizations, really identify groups that would meet those criteria, and to work with some of the bigger groups, like the roofing groups and et cetera, to say, hey, we'd really like you to subcontract. You know, we want you to meet this goal.
Is that something that you can find or share with us?
Yeah, so I could share basically the state procurement, like what the inside of it. DCEO has a really good set of like online webinars, online like YouTube videos. They have a lot of documentation. I will pull what we had to go through, but essentially the board, we could set a goal each year. We could say this is what we're looking to do. And frankly, I think that in a lot of ways, when it comes to janitorial services, these smaller services as well, it's a really important opportunity to, let's say, since we're working with immigrant services community, to really get the word out around, you know, there's a lot of roofing, janitorial, cleaning, disinfecting and other services that are run by immigrant groups, and they would qualify as minority-owned businesses, right? So looking not only at the big stuff like the roof or the solar project, but honestly getting to our goal with the small stuff as well really helps. So I'd like to see in the procurement policy that we try to set some goals, and then we track our goals. We see how we're doing. You know, how close are we to meeting that? Maybe it's either dollar, you know, X number of dollars, 15% of our dollars, 20% of our dollars. We want to go this way.
And would you do a review like each year then, you think, or every 2 years?
I think for now, looking at it annually makes a lot of sense. We can see where our dollars are going, right? And the one thing about the scoring sheet is that minority and women-owned are put together. And one note I made is that anybody who's in construction in this community knows that the guy starts the business, he puts it under his wife's name, and then he calls it a women-owned business.
Yes, we have one of those.
Just saying. I mean, that's like happens a lot. So basically, you're gonna be able to get to your minority and women-owned business quota really quickly if your whole goal is just to count the bean, as my father would say. Just count the bean. I'm just counting the bean, you know? That's not the goal, though. The goal is actually to empower underserved groups that haven't had access. And so I would, you know, and the way the state has been smart about this, and Chicago has done it too, is that they will set minority-owned business goals and they will set women-owned business goals.
And is that what you're looking to do?
And I've been sent this as an email, I mentioned at the last meeting, is I think we should separate out those two. I think that's different.
So if we have a female minority, do they get double points? Is that what you're saying?
If you do the
Technically.
point system, I believe you get double points. But I could check and see. I'm not sure how the state does it, but that's my understanding.
So Mandy, just separate those two on that little scoring sheet. So it would be,
Well, I mean, Andy's not saying one way or the other yet either, this is just Danielle.
Yeah, no, I mean, I'm supportive of those initiatives. I mean, clearly, I think we're not gonna act on anything tonight, so I think there's still some work that needs to be done, bring back and have Kyle. I don't disagree with any of that.
Would is the question then, would it, well, for your discussion then, would it be 5 points for minority and 5 points for women-owned, or would it be 2.5 points for minority, 2.5 points for women-owned? So something, just if you're giving direction to staff to look at different
Yeah.
drafts.
I'm happy to look at how the state does it, and veteran is also a category there, right? So right now it's broken out as women or minority, and then veteran is separate, so it actually prioritize, like it gives heavier weight to veteran in that case. So I think I think it's really up to the board
Yeah.
to decide where the emphasis should be. I'd like to give some thought to it. I mean, you know, off the cuff, I might say veteran or woman-owned business is 5 points and minority is 5 points, just based on looking at historical disenfranchisement. But, you know, that might help to get to that point. But we could also look at like making each of that its own and doing like 3 points, you know, for each.
A little bit on the same thing, but a little bit different. Yeah, Sean and I were talking about this, but where we have departments local, using local workers, what do you consider to be local?
Yeah,
Does it have to be the county?
Mm-hmm.
Champaign County.
Yeah.
Yeah.
We came up with Champaign County.
Mm-hmm. Yep.
Isn't it the Urbana Farmers Market that does within 200 miles or so? I
Mhm.
don't know if that's something that you guys would do, but yeah, or Champaign.
I mean, in terms of a point system, I would just say Champaign County, I would say
Yeah,
Champaign County workers and operated businesses.
Yeah, I don't know how big a jobs we're gonna have to draw people from
Yeah.
100 or 200 miles away.
And in some cases, you'll have a specialty need, and it's gonna come from Peoria, it's gonna come from Terre Haute or whatever, and I don't think there's any difference,
Yeah.
in my opinion, for our purposes, between Terre Haute and Peoria.
Yeah, well, if it's specialty, then we have to go outside to live there
Yep.
anyway.
I would have a feeling that the majority of what we do can be done in Champaign.
Mhm.
Well, I don't know, I'm gonna start looking for unusual things. Unusual situation.
We're not looking for Walmart.
I know.
And then in terms of, those were all my comments on the purchasing policy. In terms of the ordinance, I had that question before of like how the policy and the ordinance interact, because it seems like the ordinance is only about construction projects, whereas the product policy is broader, but maybe I'm not understanding.
Well, I only did the ordinance because that's what the county has, and I think that's a Bruce question. I don't know when an ordinance is required and when it's not required, or what it's supposed to do.
Well, an ordinance is like a law, when you're passing a law, but it's from a local level. A policy is sort of, this is what we're going to do. But as far as a violation, I think if you're accused of, I don't know that you really violate a policy. A policy is sort of a direction, as opposed to you're breaching or you're breaking the law, the ordinance. But I think the policy makes sense from the direction of the board, and then it can adopt ordinances consistent with that policy. I think that's how I would suggest doing it, is so you have, at least that's sort of my gut
And
reaction.
maybe you can help draft the ordinance better.
Yeah.
And I mean, like I said, I used the county on that.
Yeah, we would model it after the counties.
But that, I don't know, Danielle's questioning that, so.
But I'm just saying, so in township, the ordinance would be an ordinance that gives the spirit of why we're doing something, and then says, therefore, we adopt this policy. And the policy would be, but when I looked at the ordinance and the policy, there may be some level of conflict between the two, so the ordinance should really be something that's supporting the policy.
Right.
So the policy, for example, talks about every kind of
Yeah.
purchase. The ordinance only looks at $29,999.
Yeah.
Construction projects
And
specifically.
construction
Right.
projects, so that's where I was like, well, are these different things the
Yeah.
same? So I think the ordinance should just empower the policy and put it in place.
Right, and that, so the policy would be much more detail oriented, and the ordinance is sort of the overarching, that endorses it, but, or says we're gonna follow this policy, but policy is, you know, whether it's for 5,000 or 29,000, and it's gonna be for construction, it's gonna be for, you know.
Well, one thing I noticed on the county's ordinance is they talk about items needed, which isn't, you know, it's addressed in the policy, but it doesn't go into this level of detail, a certificate of insurance, indicating coverage of general liability, workers' comp. I mean, it's got a lot more detail in it than even the policy has. It's got, talked about the federal identification number. I have no idea how I would,
Yeah,
That's probably because they get so much federal, is it because they do a lot, I mean, they have a lot, like the whole road projects, my head about popped off when I read that thing.
but they all make sense.
Well,
And
yeah, it makes sense,
It sounds like a
but-
minimum legal thing, it's saying you gotta have insurance, you gotta have that tax ID, you know,
Yeah.
that's
Yeah.
just the minimum legal standard for people who are going to, who are gonna bid
I
for
guess-
companies.
My suggestion would be take the things in the ordinance that are important and put them in the policy, and then have the ordinance really be the thing that we pass that says we now adopt this policy. So you would look and see, you know, what is the threshold of purchasing? Do you need a FEIN for every single person that you work, or entity you work with? Is there a certificate of assurance, prevailing wage, et cetera? So, I would just, you know, I guess I would fold in what they put in the ordinance, in the policy, if it's not in the policy already, if it's relevant. And then we could ask Ruth to develop an ordinance.
Well, isn't what she has there really a policy?
it's the
As
one
far
that
as we're
says,
concerned, the thing, the whole thing, couldn't that be the policy?
It's the single two.
I mean, it
Yes.
says,
Yeah, I'm looking at the ordinance now.
oh,
And I think it's the thing that empowers the policy. That's my understanding of the ordinance.
I think that's right, but so I interpret policy as a much, more detailed thing. So you have your
It is.
9200.0 or -07.01, that's very detailed, in the ordinance, I imagine, and somebody, but a very,
It's very big.
yeah, sort of vague and overarching, thank you. Yeah, sort of, we're adopting this and this is sort of part of our belief structure. Thank you.
do you feel comfortable in writing it? Because I would rather you did it, I think, than me, because I don't feel like I have any.
like how to write
Comfortability
a
in
policy.
this.
Yeah, I was gonna write the preamble part of it.
That's
of
the, you can
explaining
make that the ordinance, whereas X, whereas Y, whereas Z, therefore be it resolved
Okay.
that we put this policy in place, name the policy, and that it shall be reviewed by the board every 2 years, you know, or every, for whatever, that piece. So the preamble would probably be the whereases. But you could also repeat that at the beginning of the policy if you wanted to.
Okay.
So you can do it?
Okay,
Yeah.
so I will ignore my comments about the ordinance, because it sounds like we'll kind of, yeah. I don't think we're only looking at construction projects only, I don't think we're only looking at $30,000 and above. And I don't think we are required, we're gonna require evidence of participation in apprenticeship and training programs
I
approved
did
by the
remove
Department
that.
of Labor.
I removed that. sentence
Okay,
out.
cool, yeah, so those were my main things with the ordinance. Otherwise, and we have addressed the issues with the scoring sheet, so I don't have further comments.
I don't either.
Okay. I'll get something.
So, yeah, you're gonna draft something and then maybe you and I should at least talk or Zoom.
Yeah, I'll start, mine will just be, you'll have to whereas it, and shall and may, or
Sure.
whatever. You do that part, and I'll just write the thing, and then you,
That sounds
Make it look
fine.
pretty.
And
I
then
can do
the,
the whereas part, but not the shall and may, you do that.
and then the policy stuff is what the board is going to make the changes to, so I'm not gonna worry about that. I'm just
Yeah.
gonna worry about this technical part.
Yeah.
Okay. Okay?
Before you were focusing on the 5,000 to 30,000. I don't think you really talked about that tonight, but I will say that Sean and I talked about it a little bit, and we don't really feel like we had that many services that we're dealing with. All we could really think about was like our waste, lawn care, shredding, just like a handful of things.
You mean between the 5,000 and 30,000?
Yeah.
In that range?
I mean, there might be more, but it was just, trying to think of things, just not really coming to mind for
Yeah.
us.
It's purchases though too, right? I mean, like, your purchasing policy includes,
The dental stuff for the clinic?
yeah, I mean, paper towels
Everything
or
you purchase.
Even
whatever.
that though, you're gonna, okay,
To
so,
reach the 5,000 threshold is, most of our regular purchasing isn't going to.
Is under that.
Yeah.
Which is
That
fine.
is under 5,000.
Yeah, which is, that's okay.
But if we set goals for minority women-owned and veteran businesses, you should collect that data when you procure, and that way you can count that
Yeah.
towards the goal. But
Yeah.
you don't necessarily have to go through the bidding process.
Yeah.
And I think that's a really healthy balance, because it allows you to like buy things quickly, but you're also, especially, with monitor, in your staff meeting, in your leadership team meeting, looking to see, okay, where are we at in terms of this?
Yeah, well,
piece?
that's why that section is there,
Okay.
so that it is easier to get stuff that's under 30,
Yep.
but the comments, I think, before that she was talking about, it's basically, there's not going to be a lot of stuff in there, but it does give us that freedom.
Not gonna be a lot of things covered over the 5,000.
Which is fine, I mean, like, that's
I
okay.
did notice that there's like, like when you have recurring funds, that's it, because a lot of things we probably buy over and over again, right?
Yeah.
So it might be helpful in the policy, I had made a note, and made some comments on the side, and I'll share this, would it be helpful to say like within a year, or, if you're purchasing something over and over again, that doesn't go past the 5,000 threshold, it's under one thing, but if you anticipate that you're gonna buy X, $10,000 in toilet paper, just making that up, because, Americans use more toilet paper than any other country in the world, then, essentially, you'd say, okay, we know we always go over 5,000 a year, so we're gonna do this thing.
Yeah, and I
I
did,
thought we do go over 5,000,
Yeah, 'cause we
definitely. Like,
do-
but we're buying it from a specialty place.
Mhm.
But that's what they do, is provide the dental supplies,
Mhm.
medical supplies, that come from those two. So I'm not really sure how you would bring the minority owned and stuff into something like that.
I mean, I think what you would do is look at what you purchase, and I mean, this is what I did when I came into township, is I looked at everything that was being purchased, and then I basically looked at who else might be supplying it, and how to meet certain goals of social service goals in the purchasing process. So I looked and I was like, okay, and I was able to actually shift,
outside of
continue to
food-
shift dollars.
Yeah, I mean, outside of when we would have a, food type of event, it's hard to think about what that would be.
We get our dental stuff outside the community, right, or do we buy it here local?
No, it's done through corporate, in a corporation.
Corporation.
It's not local.
Bigger suppliers farther away.
Okay.
And McKesson is the medical still. So McKesson is the medical, and
Patterson.
We do
Patterson.
Patterson,
Patterson's
we
local.
do,
It's local.
Oh, Patterson is?
Yeah, we are in their little building. This is the building, this used to be their building.
Oh.
Yeah, Patterson.
There's another dental one we use.
Well, they do,
Riverside.
here is the one thing that they do, over the past, 10 years or so, rather than just always having the same one, we try to find another place to kind of make sure that they stay honest with
Yeah.
this. Otherwise, because if we don't do that, and sometimes, what happens is, we find another place somewhere else, and then they'll come down, right? But they do mix it up some. I know we've changed our trash service, and I know we've changed our medical hauling services, because we keep an eye on that.
Well,
Which so we do,
well,
but what we haven't done is show that we're doing that.
yeah.
We haven't really kept a record of that, but we do that.
I'm more concerned now about how we can make sure that we're following the scoring sheet, and I guess I don't really understand how
No,
to
that's
do
not
that.
for that. She's not saying to use that, are you, the scoring sheet?
If you're spending over 5,000, you
Correct.
have to use the policy.
Yeah.
It doesn't matter what you're buying, the policy impacts everything you do, purchase, projects, everything. So it's gonna change, it sounds like, your process is rather significant.
So here's the thing. So as long as they put in an order that is under 5,000, and I can say dental supplies, they probably order about 5,000 every month. So automatically that's over 5,000 if you want to look at annual.
Correct.
Is that what you mean?
Yes.
Yeah.
So,
That's why I put in a suggestion, and, that essentially you have to look at, so people do all kinds of things like, you don't have, if you have an invoice less than $2,500, it's expensed on your taxes every year. So people will buy a roof in $2,400 increments so that they can expense the whole thing one year. So there's ways around it, but I think that the goal is, if it's a large purchase, we're going out for bid. That's the plan. So I would say, if you looked at the last year and you spent more than $5,000 on dental equipment, then yes, you would be looking to go out for bid, and you would spend, and there would be staff time invested, and we have a new staff member to support this we have 2 new staff members to support the process, to say, okay, who are the providers, and do they meet some of these criteria? And they would look out and say, okay, here's additional providers that we could consider in this case. Right, so you would, so you'd start going out for bid for a number of things. And then I think that if we set particular goals in terms of how we're moving money each year, then even the smaller things become a way for your leadership team to work towards its goals. Okay, we want to do 20%, and I'll think about it and maybe I'll propose something at the next board meeting in terms of what are our annual goals in terms of dollars out. And then you can track those goals. So every time you do work with a vendor, whether even if it's small, you say, okay, it's oldies, it's not women-owned, it's not minority, it's not nothing, 0. But okay, you did work with Rogards, okay, you know that's local. So you would just keep track of dollars out, how much you are meeting your goal, even for the little stuff.
I'm gonna have to leave soon.
Okay.
I have
I'm here to make you late.
I know. I mean, I feel like we
Yeah.
got a lot accomplished, but still
Yeah,
quite a
and
bit
we'll-
more to.
Yeah, and we'll get that written up, and we'll talk about this. One of the biggest things we're gonna have to do is all sit down, and when we get this all done, and have a training session,
For sure.
because Jim is not gonna be the one ordering dental supplies or medical supplies. There's different people all throughout the agency that do that, so it'll be we'll have to have a training.
Well, some of those we also have to consider the difficulty, not that we shouldn't try, but we have to consider the difficulty, like how many different individual dental supplies do we own? So if we're gonna bid it out, are we gonna have 100 things we bid on, and then are we gonna go to one supplier because they have one item cheaper in order to the other items from the other supplier? That's something to consider too.
Right.
I think it depends on that's based on your RFP. So if your RFP is give us a menu of items, but the RFP could also be, these are the sets of things we're trying to buy. Now, if you know that you have a minority-owned business that does some of the things here, my suggestion would be that you're like, hey, I know that if we cut it into these 2 pieces, we'll be able to reach our goal in this way, and so we're gonna put out 2 requests for proposals. This group out of Terre Haute is gonna just apply for both of them. This group will apply for one, and this group out of Terre Haute will apply for the other. You know what I'm saying? So that would be the way that you would get to your goals, which is why I think goals are important. Otherwise, it just feels like, this is not meant to be the board is imposing something on the staff. I would like to really think of this as a collaborative process. And that's why I keep coming back to the public health goal, is that we're public health professionals. We're trying to achieve public health goals. We've specifically stated that equity is a concern. The leadership team is on board with that. We had an equity task force. Love an update on that at some point. You know, we're looking at how we brought on new staff members. So like, this is towards our public health goal of addressing inequities, historic inequities. And I think in the social service sector is about,
Yeah,
you know, we can
we're
give,
pretty close
Andy
to
and
not
I
having a forum.
can give money to people all day for folks who don't have jobs. But it's much better if people are actually employed to do work and are not shut out of the workforce. And frankly, in this community is a long and deep history of historically cutting people out of the workforce. Look at the work of John Lee Johnson, look at the work of the depot, look at what it took to get the first black students on campus and the first black secretaries and laborers. It took John Lee Johnson walking their applications across University Avenue from the depot that we used to be on First Street, across University Avenue to HR and putting it in front of them and then threatening to sue them if they didn't do something with it. That's the only way that we had anyone work at the U of I who was anything other than Lily White in this community. That's the history of it. It actually takes that kind of work, right? So I feel like it's time to get in the game. It's time for public health to get in the game of racial equity, and that means put our money where our mouth is. And I'd like to see the whole leadership team on board with that piece.
I think it's more about understanding how to do it. That's really the hard part.
Yeah, but one thing I am gonna do is work with a local DCO office in Micaiah. I don't know, she's not here, I don't know if she was gonna talk to the Black Chamber of Commerce and things like that, but.
Yes,
Yeah.
bring them in to talk to staff.
Yeah, and
Have the Black Chamber of Commerce, have Black Champaign-Urbana, have the procurement folks at the city of Champaign. You know, these are conversations that can happen at the staff level with the folks who've been working on this issue. So, the Chancellor's office has done a lot of work in this regard, so.
all right.
Are we adjourned or?
Oh, yeah, I now make a motion to adjourn.
Second?
All those in favor?
Aye. Thank you, my apologies.
You do it as the board hitting on the button.
Yeah, we normally don't go this long. Appreciate it.
Thank you.
Hey, Danielle, did I get to write it down?
Yeah, sure.